Understanding peripheral neuropathy for seniors: causes, symptoms, and practical tips. Hello, dear friends. Welcome back to our health channel, where we share practical, trustworthy information to help you live your best life, especially in your golden years. We're diving into a topic that affects many seniors: peripheral neuropathy. If you've ever felt tingling, numbness, or pain in your hands, feet, or legs, or if you're worried about staying active and independent as you age, this video is for you. Peripheral neuropathy is more common than you might think. Studies show nearly 1 in 10 people over 55 experience it, and it can really impact daily life. But don't worry. Today we'll break down what peripheral neuropathy is, why it happens, how to recognize it, and most importantly, what you can do to manage it and keep enjoying life to the fullest. This is a long video because we're covering everything you need to know, from causes to treatments, with tips tailored for seniors. So grab a cup of tea, get comfy, and let's learn together. If you find this helpful, please hit that like button, subscribe, and ring the bell so you don't miss our weekly health tips. Let's get started. Section 1. What is peripheral neuropathy? Let's start with the basics. Peripheral neuropathy is a condition where the nerves outside your brain and spinal cord, called your peripheral nervous system, get damaged. These nerves are like the body's communication wires, sending signals from your brain to your muscles, skin, and organs, and back again. When these nerves are damaged, it's like a bad phone connection: messages get scrambled, leading to symptoms like numbness, tingling, or even pain. For seniors, peripheral neuropathy is especially important because it's more common as we age. Research shows that up to 8% of people over 55 have some form of neuropathy, and this number jumps to 22% for those between 60 and 74, if risk factors like diabetes are involved. It can affect just one nerve, a group of nerves, or many nerves across your body, and the symptoms depend on which nerves are affected. There are 3 main types of nerves that can be involved. Sensory nerves. These handle sensations like touch, pain, or temperature. Damage here might make your feet feel numb or like they're burning. Motor nerves. These control your muscles. Damage can cause weakness or trouble moving your toes or hands. Autonomic nerves. These manage automatic functions like blood pressure or digestion. Damage might lead to dizziness or bladder issues. For example, you might notice it's harder to button your shirt, walk steadily, or feel the ground under your feet. These changes can feel scary, but understanding them is the first step to taking control. Let's talk about why this happens, especially for seniors. Section 2. Why does peripheral neuropathy happen in seniors? Peripheral neuropathy has many causes, and for seniors, some are more common than others. Let's go through the main ones so you can see if any apply to you or someone you love. According to experts, the most frequent causes in older adults include: 1. Diabetes. Diabetes is the #1 cause of peripheral neuropathy, especially in seniors. High blood sugar over time can damage nerves, leading to what's called diabetic neuropathy. In the US, about 20 million people have peripheral neuropathy, and diabetes is a leading culprit. If you have type 2 diabetes, keeping your blood sugar in check is critical to prevent or slow nerve damage. For example, a study from the National Institute of Neurological Disorders and Stroke notes that managing blood glucose can reduce or even eliminate diabetic neuropathy symptoms for some people. 2. Aging of the nervous system. As we age, our nerves naturally change. Research shows that after age 65, sensory and motor nerve conduction slows, and reflexes like the ankle jerk may weaken or disappear in up to 70% of healthy seniors. This doesn't always cause problems, but it can make you more vulnerable to neuropathy, especially if other factors are at play. 3. Vitamin deficiencies. Low levels of vitamins, especially vitamin B12, are a common cause in seniors. B12 is vital for nerve health, and deficiencies can lead to numbness or tingling. This is especially true if you're on medications like metformin for diabetes, which can lower B12 levels, or if you have a diet low in meat, eggs, or dairy. A simple blood test can check your B12 levels, and supplements or injections can often help. 4. Medications and treatments. Some medications commonly used by seniors, like chemotherapy drugs, e.g., cisplatin, taxanes, or certain arthritis drugs, e.g. leflunomide, can cause neuropathy as a side effect. For example, studies have noted a higher incidence of neuropathy in cancer patients using monomethyl aristatin EMMAE based treatments. If you're on these medications, talk to your doctor about monitoring for nerve issues. 5. Autoimmune diseases. Conditions like rheumatoid arthritis, lupus, or Sjogren's syndrome can cause your immune system to attack your nerves, leading to neuropathy. These are more common in older adults and can cause burning pain or loss of sensation. 6. Alcohol and toxins. Heavy alcohol use over time can damage nerves, and seniors are especially sensitive to this. Toxins like heavy metals, e.g., lead, mercury, or certain chemicals can also play a role, though these are less common. 7. Idiopathic neuropathy. Sometimes doctors can't pinpoint the exact cause, especially in seniors over 75. Studies show that up to 39% of neuropathy cases in those over 80 are labeled idiopathic, meaning no clear cause is found. These cases are often mild, but they can still affect quality of life. 8. Other causes. Infections, e.g., shingles, physical injuries, e.g., carpal tunnel syndrome, or kidney disease can also trigger neuropathy. For seniors, falls or injuries can damage nerves, and conditions like Guillain-Barré syndrome are rare but possible. Understanding the cause is key because it guides treatment. If you suspect neuropathy, don't hesitate to talk to your doctor. They can run tests to figure out what's going on. Let's move on to the symptoms you might notice. Section 3. Recognizing symptoms of peripheral neuropathy. Peripheral neuropathy symptoms can vary widely, and for seniors, they can be mistaken for just getting older. But knowing what to look for can help you catch it early, which is crucial for preventing complications like falls. Here are the main symptoms, based on what doctors and researchers report. Numbness or tingling. You might feel a pins and needles sensation in your feet, hands, or legs, like when your foot falls asleep but doesn't wake up fully. This is often the first sign and usually starts in the toes or feet. Burning or sharp pain. Some seniors describe a burning sensation or sharp, electric shock-like pain, especially at night. This can make it hard to sleep or walk comfortably. Muscle weakness. If motor nerves are affected, you might notice weakness in your legs, trouble climbing stairs, or difficulty gripping objects like a cup or pen. This can lead to foot drop where lifting your toes becomes hard. Balance problems and falls. Neuropathy can impair your sense of position, proprioception, making it harder to balance. Studies show that over 30% of seniors over 65 fall at least once a year, and neuropathy significantly increases this risk. Autonomic symptoms. These are less common but can include dizziness when standing, due to blood pressure changes, digestive issues, or trouble with bladder control. Loss of sensation. You might not feel temperature changes or injuries, like stepping on something sharp. This raises the risk of infections or ulcers, especially in the feet, which can be serious if untreated. For example, you might find yourself stumbling more often, struggling to feel the texture of your socks, or noticing your hands feel clumsy. These aren't just signs of aging, they could be neuropathy. A 2021 study found that 26.8% of seniors over 70 in the U.S. have reduced sensation in their feet, a key neuropathy sign. If you're experiencing these, it's time to see a doctor. Let's talk about how they diagnose it. Section 4. How is peripheral neuropathy diagnosed? Diagnosing peripheral neuropathy starts with a visit to your doctor, often a general practitioner or a neurologist. They'll use a combination of methods to confirm neuropathy and find its cause, which is critical for effective treatment. Here's what to expect based on expert guidelines. Medical history. Your doctor will ask about your symptoms, when they started, and what makes them better or worse. They'll also ask about your medical history, e.g., diabetes, autoimmune diseases, medications, alcohol use, and family history of nerve issues. Physical and neurological exam. They'll check your reflexes like the knee or ankle jerk, test your ability to feel sensations, e.g., a tuning fork for vibration sense, and assess your balance and strength. For seniors, they might look for signs like difficulty standing on one foot, which can indicate neuropathy-related balance issues. Blood tests. These can detect diabetes, vitamin B12 deficiency, thyroid issues, or autoimmune markers. For example, low B12 is a common cause in seniors and can be easily tested. Nerve conduction studies and electromyography. EMG. These tests measure how well your nerves and muscles work. They're especially useful for distinguishing between types of neuropathy, e.g., axonal versus demyelinating. However, they may not detect small fiber neuropathy, which is common in seniors. Imaging or other tests. In some cases, an MRI or CT scan might be used to rule out nerve compression or other issues. Skin biopsies are rare but can confirm small fiber neuropathy. Early diagnosis is crucial, especially for seniors, because untreated neuropathy can lead to serious complications like foot ulcers or falls. In the UK, experts recommend regular checkups for those at risk, like people with diabetes, to catch neuropathy early. If you're noticing symptoms, don't wait, schedule a visit with your doctor. Now, let's explore how to manage and treat neuropathy to keep you active and comfortable. Section 5. Treatment and management options for seniors. The good news is that peripheral neuropathy is often manageable, and many seniors can reduce symptoms or prevent worsening with the right approach. Treatment depends on the cause, your overall health, and your symptoms, but here are the main options, tailored for seniors based on credible sources. 1. Address the underlying cause. If your neuropathy has a clear cause, treating it can make a big difference. Diabetes management. Keeping blood sugar levels stable can slow or reverse diabetic neuropathy. This means monitoring your glucose, eating a balanced diet, low in refined sugars, and following your doctor's advice. Research shows that good glucose control can reduce symptoms in some cases. Vitamin supplements. If you're low on B12 or other vitamins, supplements or injections can help repair nerve damage. Always check with your doctor before starting supplements, as overdoing it can cause problems. Medication adjustments. If a medication is causing neuropathy, your doctor might switch to an alternative. For example, some chemotherapy drugs can be adjusted to reduce nerve damage. Treating infections or autoimmune issues. For neuropathy caused by infections or autoimmune diseases, treatments like intravenous immunoglobulin, IVIG, or steroids, e.g. prednisone, can reduce inflammation and improve symptoms. 2. Pain management. Neuropathic pain can be tough, but there are safe options for seniors. Medications. Doctors may prescribe neuropathic pain agents like gabapentin or pregabalin, which are often safer for older adults than standard painkillers like opioids. Tricyclic antidepressants, e.g. amitriptyline, can also help but should be used cautiously due to risks like heart issues in seniors. Always discuss side effects with your doctor, as some medications can worsen cognitive function or increase fall risk. Topical treatments. Creams like capsaicin or lidocaine patches can relieve localized pain without systemic side effects, which is ideal for seniors with multiple health conditions. Non-drug options. Transcutaneous electrical nerve stimulation, TENS, uses low-voltage electrical currents to ease pain. Studies show it has level A or B evidence for neuropathic pain relief, making it a good option for seniors avoiding medications. 3. Physical therapy and exercise. Physical therapy is a game-changer for seniors with neuropathy. A therapist can design exercises to improve strength, balance, and coordination, reducing fall risk. For example, balance training. Simple exercises like standing on one leg with support or Tai Chi can improve stability. Research shows that neuropathy contributes to falls in over 30% of seniors, so this is critical. Strength exercises. Gentle weight-bearing exercises, like seated leg lifts, can maintain muscle strength and prevent weakness from motor neuropathy. Stretching. Stretching improves flexibility and reduces muscle cramps, which are common with neuropathy. Try joining a senior-friendly exercise class or working with a physical therapist. Even walking 10 to 15 minutes a day can make a difference, as long as it's safe for you. 4. Lifestyle changes. Small changes can go a long way in managing neuropathy. Healthy diet. Focus on foods rich in B vitamins, e.g., eggs, fish, fortified cereals, and antioxidants, e.g. berries, leafy greens, to support nerve health. Avoid processed foods high in sugar, which can worsen diabetic neuropathy. Quit smoking and limit alcohol. Smoking and heavy alcohol use damaged nerves and worsen symptoms. Quitting can improve blood flow to nerves, aiding recovery. Foot care. Check your feet daily for cuts or sores, as neuropathy can reduce sensation and lead to infections. Wear comfortable, supportive shoes and keep your feet clean and moisturized to prevent ulcers. Weight management. Maintaining a healthy weight reduces strain on nerves and improves diabetes control, lowering neuropathy risk. 5. Assistive devices. For seniors with weakness or balance issues, devices like canes, walkers, or foot braces can improve safety and mobility. Occupational therapy can help you adapt daily tasks, like using adaptive tools for buttoning clothes or gripping utensils. 6. Multidisciplinary care. Neuropathy often requires a team approach, especially for seniors with multiple health conditions. Your care team might include a neurologist, physical therapist, dietitian, or pain specialist. In Western countries, multidisciplinary care is recommended to promote self-efficacy, your confidence in managing your health. 7. Caution with alternative treatments. You might see YouTube videos or ads promoting alternative treatments like supplements or devices for neuropathy. Be cautious. Research shows that only about 30% of YouTube videos on neuropathy discuss evidence-based treatments, with many focusing on unproven alternative therapies. Always check with your doctor before trying new treatments to ensure they're safe and effective. Section 6. Practical tips for seniors living with neuropathy. Living with neuropathy can feel challenging, but these practical tips can help you stay active, safe, and independent. Here's what you can do every day. Stay active safely. Try low-impact activities like swimming, chair yoga, or walking with a cane if needed. Aim for 10 to 20 minutes daily, but stop if you feel pain or dizziness. A physical therapist can tailor a plan for you. Check your feet daily. Use a mirror or ask a family member to inspect your feet for cuts, blisters, or redness. Neuropathy can make small injuries hard to notice, and infections can become serious. Wear proper footwear. Choose shoes with good support and cushioning. Avoid going barefoot even at home to protect your feet. Orthotic inserts can help with comfort and stability. Improve home safety. Remove tripping hazards like loose rugs, add grab bars in the bathroom, and use nightlights to prevent falls, especially since neuropathy increases fall risk in seniors. Manage pain naturally. Try warm, not hot, foot baths, gentle massage, or relaxation techniques like deep breathing to ease discomfort. These are safe for most seniors and can complement medical treatments. Stay connected. Join a support group for neuropathy or diabetes to share experiences and tips. The Foundation for Peripheral Neuropathy offers online and local groups to help you feel empowered. Track symptoms. Keep a journal of your symptoms, noting when they occur and what helps. Share this with your doctor to fine-tune your treatment plan. Eat for nerve health. Include foods like salmon, walnuts, spinach, and eggs for B vitamins and omega-3s. Limit sugary snacks to keep blood sugar stable, especially if you have diabetes. Monitor medications. If you're on multiple medications, ask your pharmacist or doctor to review them for potential neuropathy side effects, as polypharmacy is common in seniors. Stay positive. Neuropathy can be tough emotionally, but focusing on what you can do, like enjoying hobbies or spending time with loved ones, can boost your mood and motivation. Section 7. Preventing complications. Untreated neuropathy can lead to serious complications, especially for seniors. Here's what to watch for and how to prevent them. Falls. Neuropathy impairs balance, increasing fall risk. A 1998 study found that seniors with neuropathy are more likely to have major injurious falls. Use assistive devices, clear walkways, and practice balance exercises to stay safe. Foot ulcers and infections. Loss of sensation can lead to unnoticed injuries, which can become infected or, in severe cases, lead to amputation. Daily foot checks and proper shoes are essential. Autonomic complications. If autonomic nerves are affected, you might experience low blood pressure or heart rate issues. Treatment like medication or a pacemaker may be needed in rare cases. Emotional impact. Neuropathy can lead to frustration or depression, especially if it limits activities. Talking to a counselor or joining a support group can help. Studies show self-efficacy. Believing in your ability to manage your condition improves outcomes. Regular checkups with your doctor can catch problems early. If you have diabetes, aim for annual neuropathy screenings, as recommended by the NHS. Section 8. When to see a doctor. If you notice any of these signs, don't wait. See your doctor right away. Persistent numbness, tingling, or burning in your hands or feet. Sudden weakness or difficulty moving your legs or arms. Frequent tripping or falls. Wounds or sores that don't heal, especially on your feet. dizziness when standing or changes in digestion or bladder function. Early action can prevent worsening and improve your quality of life. Bring a list of your symptoms, medications, and questions to your appointment to make the most of it. Section 9 Myths and Facts about Peripheral Neuropathy. Let's clear up some myths you might hear, especially on platforms like YouTube, where not all information is reliable. Myth: neuropathy is just a normal part of aging. Fact: while nerve changes happen with age, symptoms like numbness or pain aren't normal and should be checked. Myth: only people with diabetes get neuropathy. Fact: diabetes is a common cause, but vitamin deficiencies, medications, and other factors can also cause it. Myth: there's nothing you can do about neuropathy. Fact: many treatments, from medications to lifestyle changes, can manage symptoms and improve quality of life. Myth: alternative treatments on YouTube are always safe. Fact: many YouTube videos promote unproven therapies. Stick to evidence-based treatments recommended by your doctor. Conclude. We've covered a lot today, friends, from what peripheral neuropathy is to how you can manage it and stay active in your golden years. Remember, you're not alone. Millions of seniors deal with neuropathy, and with the right steps, you can keep doing the things you love. Start small. Check your feet daily, eat a balanced diet, and talk to your doctor about any symptoms. Knowledge is power, and you're taking a big step by learning about your health today. If you found this video helpful, please give it a thumbs up, subscribe to our channel, and hit the bell icon so you don't miss our weekly health tips for seniors. Share this video with a friend or family member who might need it, and let us know in the comments. Have you or someone you know dealt with neuropathy? What tips have helped you? Your stories inspire us all. For more resources, check out the Foundation for Peripheral Neuropathy at foundationforpn.org. They have free brochures and support groups. Stay strong, stay safe, and I'll see you in the next video. Take care.